Hello and welcome back to Casual Conversations. This is a video series presented by the Association of Cannabinoid Specialists that features panel discussions with physicians and scientists on various topics related to the use of cannabis as medicine. My name is Christine Goedhart. I will be the moderator for this episode's conversation, and I'm joined by our panel of cannabinoid physicians, which includes Dr. Jordan Tishler and Dr. Adam Abodeely. Thank you both for being here.
You bet.
Today, we're going to focus on dementia, which is an umbrella term for a range of symptoms affecting memory, mood, cognition, and behavior. While Alzheimer's is the most common form of dementia, it can also result from several other causes, such as from a stroke or brain injury. And this is an important topic because this complex neurodegenerative condition affects tens of millions of people worldwide and presents unique challenges not only for the patients, but also for families and caregivers. And increasingly, people are turning to cannabis to help treat symptoms of dementia. So let's delve into this from a clinical standpoint and hear from each of you about how medical cannabis is being considered in dementia care and your perspectives on the best ways to support dementia patients using medical cannabis treatment. So Adam, how about let's start with you. Tell us a little bit about your clinical experience with using cannabis to treat patients with dementia.
Sure. Cannabis for dementia is something that I think it's a very important topic. I think it's an important topic because there's a lot of, there's a lot of questions that come up about it. There's a lot of interest, but also I think we also have to keep in mind that there's a lot of cannabis consumers in the US right now, and none of them are getting younger. And as time goes on, they're going to naturally develop some form of, several of them are going to develop several, dementia of a variety of different forms. So we're also going to be in a position where consumers who are already consuming cannabis who develop dementia will have to kind of figure out, how to treat them, and do you continue cannabis care? There might be a knee-jerk reflex for some providers to stop cannabis if someone's using cannabis for another condition and they start showing signs of dementia, so I think it's important for us to be talking about this so we can start to try to figure out, give some real practical guidance for clinicians. Um, you know, Cannabis for dementia, we talk about this, with a lot of these topics that we discuss, the role of, cannabis in dementia care is largely to treat symptoms and improve quality of life for people with dementia. Just as is the case where, people want to believe that cannabis can cure everything. There are people who, are interested in cannabis as it relates to the neurodegenerative and inflammatory effects that the brain undergoes particularly in something like Alzheimer's disease, and whether or not, cannabinoids can actually prevent disease progression or reverse disease. And unfortunately, I'll say that, we're not quite there yet. We certainly can't make any of those types of claims. But I certainly have found cannabis to be a useful adjunctive form of treating a variety of different symptoms in people with dementia, even patients in nursing homes. And I've done that through family involvement to get new medications on board, which cannabis has to come through my door in order to happen. So I have been involved in these discussions and the recommendations of that. And with some things we have to keep in mind, again, first, what are we trying to treat? Is it a deal with insomnia? Because that would lead us to making different recommendations about dosing and frequency and timing and things of such. Are we dealing with agitation? Are dealing with potential depression, hostility, agitation, things like that. And unfortunately, in a lot of cases, we won't know how patients respond until they actually try it and see if it can make a difference. I have found it to be beneficial for patients with dementia, particularly who have agitation, and sleep. Quality of life is something that becomes harder and harder to measure, because quality of life is a survey-based variable, and as people become more and more demented, their ability to have a reliable to reliably fill out a quality of life survey becomes diminishing over time. So quality of life is a hard thing, I think, to to try to track in these patients, but, we certainly can see how quality of life can even potentially can be affected. The quality of life can be affected even by those around them, caregivers, family members, who might be stressed out and anxious over seeing their loved one being stressed out, anxious, agitated. Well, if when cannabis works for the patient, it tends to help caregivers as well. And so I've found it to be certainly a somewhat of a trial and error learning, and a learning process along the way of working with cannabis with dementia patients. But also in these patients who are, more elderly, maybe a bit more frail, more prone to falls, we always have to, take some of their medical history into consideration, their fall risk into consideration, particularly when dealing with THC. So, dealing with higher doses of THC in the beginning is usually not something I advocate for. I usually try to start with lower concentrations of THC in the 1 and 2 milligram dose ranges to start and see how patients respond to it and make adjustments from there. But again, I do think that it plays a very valuable role and can play a valuable role as an adjunctive therapy to treat a variety of different symptoms in dementia patients, but also something that we just have to kind of keep in mind as we're going to be running into a larger population that's going to become demented that's already using cannabis sometimes for, whatever we want to call it, adult use, recreational, whatever we want to call it. From some people will be using it purely as a medicine and a part of their therapy. So, we'll have to consider that as we see the population age that's using cannabis.
I think that there's actually an interesting twist on that, which is, and I hope some epidemiologist is going to look at this prospectively as this population ages, but it'd be really interesting to see whether the cannabis using population gets less dementia than the non-using population. I mean, that's the kind of thing we wouldn't necessarily see unless we're looking for it, right? It may be that there may be something there. Who knows?
Yeah, absolutely. I look forward to seeing that for long things. I've always asked, what are the effects cannabis has on longevity? These are things we don't know. And so it's similar to these neurodegenerative conditions that in another 10, 20, 30 years, hopefully we'll have some more information on.
Yeah, absolutely. And it's interesting that you mentioned longevity, not to get too off topic, but there are all these cellular studies that look at telomere length and how THC makes that worse and all this stuff. But to my knowledge, clinically, stoners are not dying at younger ages than non-users. Certainly, if you then account for other confounders like socioeconomics and exposure to cigarettes and blah blah blah. So it's really hard to know what those um, lab studies, what the implication is for actual human survival. More to be written, exactly.
Yeah.
When I think about dementia, treating dementia. Um, which I will say, not only have I been doing this clinically, professionally for a long time, but my father ended up developing frontotemporal dementia, and that was a long and very painful process for everybody. But it really gave me the shoes on the other foot experience that you try to take something from, and it helps you, I think, become a better clinician. Um, and we definitely tried cannabis, but I think that it's also important for us to recognize that all of these neurodegenerative illnesses are in fact degenerative, meaning that there is a time course to them. And so when you are sitting with a patient who has mild cognitive loss, right, which we think is then going to progress, then the issues you're grappling with for them at that time are different, meaning that's where you're talking about anxiety, maybe even some depression and insomnia and those sorts of things. And then as time goes on, some of those symptoms, as you say, become less obvious in the sense that there's less ability to communicate about them. And then things like anxiety presumably start to translate into things like agitation and aggression. And so the use of cannabis becomes it's really kind of the same issue, but our understanding of it starts to transition. And when we start to talk about behavioral control, right, where, dad is now taking a swing at the caregivers, but if we give dad a 5 milligram or 10 milligram gummy in the morning, then he's happy as a clam and he's nice to his caregivers and he's not zonked. We're not making anybody into, drooling in the corner, but he's engaged, but he's pleasant and kind and those sorts of things. That's a major advantage and a major breakthrough in the progression of these diseases, where unfortunately people get non-communicative and often combative, particularly in the Alzheimer's type. Um, so I think, that viewing it in that context of the progression is tremendously important. And then I think you also really touched on an extraordinarily important point, which is that all illnesses, but certainly the neurodegenerative ones, are a community event, right? It is not just the patient as an individual who is suffering, but it is everybody around them, the children, spouses, caregivers, all of the important people. And that being able to intercede in a way that gives the patient some quality of life or some respite from their symptoms gives respite to those other people as well. And that really can't be underestimated. And especially because, it's called the long goodbye for a reason. And if you can get mom or dad to a place of calmness, then sometimes you can have a better interaction, right? And you can have a few moments of mom or dad back. Doesn't last, but it's something. And if we can achieve that, then I think we've really made some progress for all the people concerned. Sorry, this is provoking some emotions for me that I really didn't anticipate in this context, but uh, yeah, so I think it can't be underestimated. I also think that it's important for us to be able to address the concerns of those caregivers, right? I mean, I know that when my dad was getting sick and I said to my mom, who was the primary caregiver, I think we should start giving dad some gummies. She didn't have anything against cannabis in general, but there was definitely I'm not so sure, I want to give it to your father, right? Kind of thing. And so being able to kind of sit with the family, with the caregivers and listen and respond to their concerns and to hopefully get them past the fears of what is it going to really do and is it going to turn them into an addict or, a stoner or all those sorts of things. Um, that's necessary for us to get to the place where we can then get them on board so that they can reap those benefits.
Yeah, no, I agree. That's a great point, about it being a community event. And of course how do they currently treat agitation in patients with Alzheimer's? Well, they sedate them and they sedate them and they sedate them. And so, and, and, and that leads to, really a less than optimal interaction between family members, because you basically have somebody who's basically completely, for lack of better terms, is drugged up, and we see this parallels end stage cancer patients as well, particularly those who are dealing with pain. Before we could incorporate cannabis, we were just throwing opioid after opioid after opioid, which then it basically creates a non-responsive, drooling individual who at least family's happy they're not in pain, but they don't have any meaningful interaction with them. So, and that obviously has, effects on, the quote unquote community and the family around. And I've seen that, that's a lot of times just as, if not more therapeutic for the 10 people standing around them than it is for, for the patient. So, I agree to your point that, this is a community event. I like that term.
there's nothing like that ability to interact that opioids or Haldol really rob us of. And there are, don't get me wrong, when the cancer pain gets to that level, there is nothing, you know, like morphine, right? I mean, that's where we're going. But there's a lot of time between the onset of badness and the end of the badness where we can get some quality back if we use cannabis as opposed to some of those other drugs. And as a former ER doc, I certainly gave lots of Haldol in my day. And under the right circumstance, particularly in the emergency room, it is a magnificent drug, but I wouldn't want to give it to anybody I didn't have to. I hope never to experience it myself. Um, and I think that cannabis just, has the ability um, to get a similar benefit without the sort of ironclad consequences that come from some of these drugs like the phenothiazines. And so if we can do that, if we can use the nuanced approach, particularly in the non-emergent setting, that just gets us a whole lot of much better outcome for, again, the patient and, as we've been saying, the community around them.
Yeah. So this sounds like it's a special case of uh, really helping patients and caregivers and families navigate this process. And I'm wondering, are there any special considerations that you have to take into account when treating patients with dementia that you've experienced that's different than from other conditions?
Well, I would start by saying that it's just, just got to take that particular population into consideration as it relates to their age and other medications they're on, and of course, what other medications are they currently being treated with to control things like agitation, to improve things like sleep, because these can all have interactions, and but it also goes to a point that we try not as providers just to stack another medication on. And so when we add a medication like cannabis, we hope that it can, certainly show an improvement in symptoms, but even hopefully minimize frequency or decrease dose requirements of some other medications that have unwanted side effects.
Yeah, I think that's right. Polypharmacy, particularly in the elderly, it's a huge issue. Um, Across the board. Certainly, when we get into the dementias, that becomes a huge problem. And, you know, I think it's important, for people who are listening to this to understand that we're not saying this is going to fix things. We're not saying that this will, rid you of the need for these other drugs that are available. It's more that if we start with cannabis, for example, then we may not need or maybe need less of the benzo or the phenothiazine or the opioid. And that generally speaking, even if we're using some of those conventional medications, because it's less frequently or a lower dose, like you said, then generally the outcome is more gentle and beneficial.
Mhm.
And frankly, I don't know that that's necessarily so specific to the dementia patient. As you pointed out, Adam, it's certainly true for our cancer patients as well. Um, so yeah, I think that there's just a lot of that kind of nuance that we need to be able to get to. And I've said this before. I think that for people with these advanced, complicated illnesses like dementia or other neurodegenerative illnesses, uh, the patient and their family and caregivers really, I think, should be aware that there is a lot of sort of cannabis lore and misadvice out there, particularly at the stores where you might be buying your cannabis. And frankly, I would avoid that if I could and seek out a clinician like those at the Association of Cannabinoid Specialists, who've really spent their lives dedicated to figuring out how to use these things in these contexts in a way that's successful, because that's going to lead to the best outcome and not create problems.
Agreed.
Great. Well, before we close, I'd like to ask each of you to share one key thing that you want the audience to take away, or a hope that you have for the future of cannabis in treating dementia. So what do you want to leave us with?
Well, I'll start by saying that again, I just hope that cannabis gains some increased acceptance because I think that it can be very beneficial in this population, and it's just going to require continued, education. And as Jordan mentioned, there are nuances to this that are very important to consider for successfully using cannabis and to minimizing side effects and decreasing potential polypharmacy. And so I just hope that we can continue to educate, our providers and society at large to understand that there is a role for cannabis in dementia care. I do believe that, and hopefully we'll continue to see that progress forward.
Absolutely. And I think, I would say, look, just to echo Adam's sentiment there, there's an incredible amount to know about how to use cannabis successfully, particularly in complex patient populations like dementias. And the association has a whole bunch of coursework that is focused on sort of general approaches to cannabis medicine, as well as specific groups like geriatrics and folks with dementia. So I think that for those listening, I would absolutely recommend, if you have that kind of interest or those populations under your care, absolutely head on over to cannaspecialist.org, look at our coursework, get involved that way. I'd also like to go out and say, look, I think that there's all that sort of fuzzy discussion about whether cannabis is in fact able to modify the progression of the disease. And we've got a lot of really interesting and exciting, positive preclinical research. It's absolutely not ready for prime time, but my fingers are crossed that it pans out and that we end up getting some approaches, some medicines from, based on cannabinoids or derivatives thereof. Because frankly, right at the moment, we don't have a lot to offer, and it sure would be nice to have something better.
Great. Well, with that, I want to thank both of you, Dr. Jordan Tishler, Dr. Adam Abodeely, for sharing your experiences and insights into this topic with us today. And for those of you watching, I want to thank you for taking the time to listen to this conversation. I hope that you're leaving with a better understanding of the clinical perspective of using cannabis to treat symptoms of dementia. And I'm going to echo Jordan by saying if you're interested in learning more about cannabinoid medicine, please check out the education section of the ACS website, which includes videos, blogs, and courses on a variety of relevant topics, including this one. And you can find all this at cannaspecialist.org. And if you aren't already, please consider becoming a member and joining us in the effort to advance evidence-based cannabinoid care and to shape the future of medical cannabis through education, research, and advocacy. Thanks again. I'm looking forward to seeing you next time.